Alexandria symbolizes New York City's journey to become a life sciences hub. And it's now home to the new Pandemic Response Lab, or PRL, which is serving a critical purpose in the city's fight against COVID-19. The lab, which was just opened last week, is dedicated to processing COVID-19 test results for health and hospitals in 24 to 48 hours. Every result the lab has been sent so far has been returned to patients within 24 hours. This is a major achievement for New York City, and it's a testament to our innovation and our creativity. It exemplifies the best of our city. And while we'd love to have you in the lab, for health and safety reasons, we're hosting the event outside. From the very beginning of this, it's been clear that we cannot rely on the federal government or global supply chains to solve our challenges. That's why we took matters into our own hands. We built over 8.4 million face shields in New York City and 4 million gowns for hospital workers. We manufactured our own bridge ventilators and over 500,000 test kits for New York City. There were days where without those test kits, we would have been unable to serve patients when they came in to be tested. And that's why we're taking testing into our own hands too. We have the capability, the talent, and the ingenuity to do it right here in New York City. And as long as we're living with COVID-19, rapid, accurate testing is absolutely essential to keep our people safe and reopen our economy. So in June, we set out to build our own lab, and we did it in a matter of weeks. It was a true multi-partner, cross-sector collaboration. It was led by my team at EDC with incredible partnership from health and hospitals and the Department of Health. It uses technology licensed from NYU Langone Health. Brooklyn-based Opentrons, a robotics company focused on the life sciences, worked with diagnostic experts from P4 Clinical, Health and Hospitals, and the New York City Test and Trace team to launch PRL. The lab is up and running. By the end of this month, it can do 10,000 tests a day, and by November, it will be able to do 20,000 a day. PRL will build the city's existing capacity and provide faster results dedicated to New York City residents. And it'll provide New Yorkers with good-paying jobs. It's already employing close to 100 people, and we expect it to be to 150 by November. I'm incredibly proud of our team, who worked tirelessly to make this lab a possibility. And I'm proud about what this lab says about our city. Creating lab capacity right here is another example of the creativity and innovation of New York City businesses and institutions that can make the impossible possible. We have proven time and again that we can do things right here in New York City. And PRL is just one component of the city's larger strategy to reopen and recover. This pandemic reinforced the direct connection that exists between public health and the economy. Safe reopening through innovations in testing and a series of policies that directly connect the health of New Yorkers to the health of the city's economy will create a healthier, stronger, and more inclusive New York City. I'm now pleased to introduce someone that I've gotten to know quite well throughout this crisis, someone I've spoken to probably 100 times in the last 6 months, and naturally in these extraordinary times, someone I had not met in person until 15 minutes ago. And with that, I'm very pleased to introduce Dr. Jay Varma, who brings tremendous expertise to his role. From Ebola to HIV, Dr. Varma has built new public health systems and led epidemic responses here in New York City, as well as in Asia and Africa. I have deep respect for his work and his vision. Jay?
Great, James. Thanks for that introduction. Yeah, and it's one of those unusual things that we finally get to meet in person. And of course, it's an incredible opportunity to meet here at this particular moment, given how important this new facility is for New York and for our immediate coronavirus response. You know, when reports of the novel coronavirus first emerged, in January. I was far away from New York City. I was actually based in Addis Ababa, Ethiopia, working at the African Union, working to develop a strategy to prepare the continent for what we knew would be a devastating epidemic. For that strategy, I drew upon lessons that I had learned fighting epidemics from around the world, including, as James mentioned, the Ebola response here in New York City and in West Africa. Some critical questions. How do you train disease detectives to detect disease early and to trace contacts effectively? How do you keep healthcare workers safe from being infected in the middle of a dangerous epidemic? The tools we use to protect health are actually the same here in New York City and around the world. The problem is that they're not evenly distributed. And over 9 months into the coronavirus pandemic, we see how much suffering has been here in New York City because of this disease. But we've also shown how the city can fight back with public health, with science, and with partnerships. To win that fight here in New York City, we have drawn from the vast talent and infrastructure and community engagement, and we've built and extended our collaborations with public health leaders in Europe, in Asia, and in fact in Africa. We need to continue that work. We all breathe the same air. Viruses don't need visas to cross borders. And climate change is rapidly accelerating the emergence of new infectious diseases. So we have the opportunity to share the lessons that New York City has learned with other cities and countries. New York City can partner with academia, with private sector, and with partners both here in the United States and around the world to train public health and healthcare personnel, and to innovate public health practice, and to research and develop new solutions. The critical questions remain that we can help and work together to solve. How do we forecast and model outbreaks similar to what we do with the weather? How do we detect and control outbreaks faster? How do we get diagnostic tests actually into the hands of the people as opposed to always being restricted to, say, a laboratory or a doctor's office? And how do we build the next generation of diagnostics, vaccines, and treatments and make sure that they're equitably distributed to all? How do we ensure that equity is not just a word we use, but something that actually means something to the daily health of people? So New York City is really poised right now to lead and innovate the next generation of public health solutions and to train the next generation of public health leaders here in New York City, nationally, and around the world. We need that for our own health and security and for the health and security of everyone around the world. And so I just want to close by saying I've had the tremendous honor to work, with the team at City Hall and directly for the mayor since early April. And I have really gotten a chance to see firsthand the commitment to mobilizing every possible resource to strengthen the health response to this crisis. And now, of course, to use those lessons to help New York City more resilient and the rest of the world more resilient. Thank you, Mr. Mayor.
Good morning, everybody. Listening to Dr. J. Varma, I'm reminded of a conversation I had with him months ago, where he talked about his experiences in China, in fact, in Hubei province. And he talked about how diseases that just a few years ago might have stayed contained in a very local area, now in a more globalized world, travel, not just in one province or in one country, but literally to continents all over the world. And that this is a new reality we face. And we need new solutions for this new time. And when you speak with someone of Dr. Varma's experience, it can be sobering, it can be humbling. But it was also a call to arms, that this world has to handle our new reality differently. And we did not ask in New York City to end up being the epicenter of this crisis in this nation and one of the places that was hardest hit in the world. We never wanted that distinction, but it has forged us in fire. It has educated us, it has strengthened us, it has made us particularly well suited to confront this challenge and the challenges that will come. To be the place that creates the solutions. To be the place that understands the problem like nowhere else, that understands what it means for everyday people of every background from every corner of the world, because in fact in New York City, here in this global city, we have communities from all over the world in one place. And the solutions we create here can save lives everywhere. So I want to thank Dr. Varma for having played such a crucial role in our fight against the coronavirus. I want to thank James Patchett and his whole team for the amazing work that they have done, constantly innovating, constantly fighting back, creating in New York City what did not exist just a year ago, but drawing upon the strength that is New York City, drawing upon our extraordinary creativity and drive and energy and talent to create solutions right now that our national government did not provide to us, but that we created for ourselves. And in that is the essence of what we're going to talk about today, because that shows us our future. I want to thank everybody at the Alexandria Center, because this is one of the places building the future of New York City. I want to thank John Brennan Badal and the team at OpenTrons. Thank you so much for the extraordinary effort in operating this pandemic response lab. Again, creating from scratch a solution. I can't tell you how many times talking to national healthcare leaders, talking to our federal healthcare leaders, asking them why we couldn't get more testing, asking them why we couldn't get faster lab results, why the largest city in the nation wasn't getting what we needed, nor were cities and states anywhere else. And what I heard time and again was a sense of resignation, a cursing the darkness. Too many words about what our country couldn't do instead of what we could do. But here in New York City, we have taken a very different approach. We have focused every day on what we could create. And the people here around me, all of them deserve great credit, and all their teams, because they would not be defeated. Over these last 6-7 months, time and time again, New Yorkers resolved to get the job done, and in fact did get the job done. So this is the right place to talk about where we move from here. And I don't want for a moment to forget what we experienced. It's unforgettable, very sadly. March, April, one of the worst times in the history of this city. Those we lost, and every single one of us knows people we lost, families who lost loved ones. I don't want to minimize how bad it has been and how long it will linger with us. The pain of 1 million lost jobs, the confusion, the fear. I don't want to ever forget the emptiness of the response from our federal government. I don't want to ever forget all the times we asked for testing and weren't given it. All the times we asked for help and it was ignored. But I'll tell you something, New York City didn't back down. And there were heroes everywhere. And every day we should reflect upon those heroes, particularly our healthcare heroes, because they couldn't imagine running from the fight. And we saluted them as New Yorkers, and we need to keep saluting them because they saw us through. But they also exemplified the spirit of New York City for the world to see. So we remember that we were the epicenter of this crisis, unquestionably, tragically. And now we note with pride as New Yorkers that we went from being the epicenter of the crisis to becoming the envy of the nation. Day after day, at 1% positive rate or less, day after day, our economy starting to come back, our schools starting to open, things that many doubted. They're happening one after another because of the resolve of the people of this city. And this is the X factor. You will not find New Yorkers anyplace else but New York City. All of you are the X factor that made this possible and will make our future greatness possible. The sheer resolve and discipline, every single day doing what it took to protect each other. Those simple acts like wearing a mask and practicing social distancing times 8 million people one day after another has brought us back and will continue to make us stronger. But now we look to the future and we recognize that we are in a transformative moment. Sometimes in the middle of history, it's hard to see it. But I remember the stories of the Great Depression in my family. I remember every time we gathered for a holiday around the table, inevitably, our elders would talk about that time that to them defined their lives because everything came unglued and it looked unsurmountable at times. They told the story of New York City in those years and how people banded together and fought back. And now we look back at the 1930s and understand it was a profound transformative time, that in the pain, despite the pain, came solutions that today still govern us, that today still provide the underpinnings of safety and security and decency in our society. That was a pure, historic, transformative moment, and this is too. We are living in it. I've talked to you many times about my father fought in World War II, and we say the greatest generation. They deserve that title. But now a new greatest generation must emerge because we are in that type of fight, a fight for the ages. And I am convinced that the people of New York City has already shown the ability to create that greatest generation again. There's no question in my mind, we are rising to the moment and we will rise further. So today, we lay out the foundations of our recovery agenda. Today, we present a vision that focuses on public health and social justice. These will be the pillars of our future. And here's what we have learned. Public health is economic health. It's not something we fully understood before this crisis. Let's be clear. Public health is economic health. There is no economic health without public health. And thank God we invested in public health long before we ever heard the word coronavirus. Thank God billions of dollars were invested in health and hospitals to make it strong. We did not know why that would be so important in the context of the pandemic, but thank God our health and hospital system was ready. Thank God we invested in guaranteed health care for all New Yorkers, because we've seen in countries all over the world that the strongest and best responses have been where there is a thriving universal public health system, and our nation still lacks that. Our foundational problem. But in New York City, we have built our own version. Thank God we understand there is no health without mental health. This crisis has pointed out as well. Mental health challenges loom just as large as physical health challenges. And this city has devoted itself to truly providing mental health for all. Thank God we have some of the truly greatest teaching hospitals on the earth. And thank God we have a growing life sciences industry, and you see it here at the Alexandria Center, and this is just a beginning, because we are destined to be one of the great life sciences capitals of the world. We can transform New York City into a living laboratory, a place where great innovations occur, great innovations are achieved and put into practice immediately to benefit all people. New Yorkers don't just believe in theory, we believe in practice. And here, we can take ideas and put them into action. And as we do that, we will create more and more jobs, and we will bring our economy back stronger than ever. There are so many industries that have been historically strong in this city, and there are some that have come up stronger in recent years, but there is a potential here that is vast to do good and do well at the same time. So let me offer 4 core principles for this public health vision, this vision of recovery through public health. 1, we must continue our momentum and then build further progress in the fight against COVID-19. 2, we must invest in innovation to make us a stronger hub for public health research. 3, we have to create new high-quality jobs that improve the health of our people. And 4, we have to focus on historically underserved communities, the places that didn't get the investment. Because we have to right that wrong and recognize that we are truly all in this together. And if one community of New York City is not healthy, we all are not healthy. In the coming weeks, we will provide detailed plans to realize this vision. And as you see these plans, there will be an obvious focus on the immediate challenge. We have to overcome COVID for everything else to be possible. And so we must expand our COVID testing. We will create a new citywide rapid testing program. And that begins today, kicking off a rapid testing design competition to bring the best ideas forward. Because rapid testing will be one of the keys to overcoming this crisis. Quick, reliable testing is what will help get more and more New Yorkers back to work safely. And this lab, with the ability soon to process 20,000 tests a day, will be a key part of that solution. We know, after so many painful examples, we know not to wait on our federal government. There is, to this day, still not a full and reliable national testing infrastructure. It does not exist. But here we will create what we must create to protect our people and move us forward. We must prepare for the day when a vaccine is ready, because the vaccine is step 1, but implementing it, getting it to the people quickly and effectively, is the second and necessary step to overcome the coronavirus. And we'll take lessons from the H1N1 crisis to quickly distribute a COVID-19 vaccine. And we have to understand that the future of New York City and the future of our economy then depends on taking everything we've learned and building rapidly upon it. New York City must be a global hub for public health research, for development, and for the practice of new ideas and approaches. We must do it because we can't depend on anyone else to do it. We must do it because we have the talent and ability to do it. Here in New York City, we can serve this nation and this world in a way that no other place can. And in the process, we will establish a new strategic approach to healthcare that is truly inclusive. Because we know for generations, healthcare has gone to those who can afford it. And we saw the disparities laid bare in this crisis. And that cannot be. It is not only morally wrong, it will hold us back. It will hold us down. And so we here will create new strategies to show our nation, our world, what it means to truly provide health care for all. And we will bring together partners, because the talent is already here right this minute. We'll bring together partners who may never have worked together, but they will work together now in common cause. Doctors and nurses, academic researchers, industry innovators, healthcare nonprofits, and economic development organizations at the community level. Folks who may have thought their missions were different will now see their mission as one. Because healthcare must reach the people. It's not good enough if it's a great idea or it's only for the few who can afford it. Our vision is great new ideas that reach into every corner of every neighborhood of this city and then can be used all over the world. We will revolutionize our healthcare workforce by launching a public health corps. We have seen already in just a few months what Test and Trace has been able to achieve. We've seen what it means to have public health workers who can go within minutes out into communities and make a difference and educate people and help people and guide them. What a difference it makes. We will build on that example. We'll take this model and these talented, committed New Yorkers and build something lasting. And that will build the communication and the trust needed to bring every neighborhood into the future of healthcare. Because we've also learned powerful lessons about how much information matters, how important it is for people to see what they need to do and believe in it. We'll create dedicated research and development facilities that not only create cures, but then ensure the cures reach the people. That those cures will be provided on a broad scale, and we will deploy those new approaches and then track the impact on communities to ensure they work for all. And think about what it means then for our future. It means that we will fundamentally change the health outcomes in the communities of the city. That will make us stronger. It means, God forbid, another pandemic arrives on the scene. No city will be more ready than New York City. It means that the models we create will be sought after, and people from around the world will come here to learn how to do it. And while we're talking about our future and while we're talking about health, let us never forget the pervasive, unyielding health crisis that is global warming. We will all be involved in that struggle in every corner of the world. But again, we understand that global warming has powerful health ramifications. We understand that we can't keep our people as safe as they need to be if we don't fight global warming. And so here in New York City, on Governor's Island, we will create the centerpiece for the global fight against climate change. On our Governor's Island, where New York City as we know it today began, you will find the greatest minds, the ideas being generated, the hope being created that we can overcome global warming. We have here in New York City so many innovators, so many people who want to create new models that are sustainable, that want to be part of the solution, that want to see a healthy city, that want to fight the larger threats we face. The level of commitment in this crisis has been extraordinary, and it will only grow. And we will prepare New Yorkers to fight against the health challenges of tomorrow. Whatever those health challenges must be and will be, we will train New Yorkers to fight against those health challenges. We will train New Yorkers to create a greener city and a greener world. What we do here can be the model. And I believe we will be the climate solutions leader, not only this country, but of the entire world. So, the simple point here is we can do this. We can create something new. We can take what we've learned and build upon it. So we will make sure that these partnerships grow. We will make sure that these lab facilities grow, that these innovations come more and more frequently. And we will remember that it only works if it works for everyone. It only works if every community benefits. And I will say, for the record, we understand everything is interrelated. We understand that you can't be healthy if you don't have quality housing. We understand you can't pay for medicines if you don't have a job. We understand that people need green space and places to exercise. We understand that people have to get to work and opportunity with a quality mass transit system that also helps us move away from the American addiction to the automobile. All these pieces are interrelated. But what we have learned in these last 7 months is it begins and ends with healthcare. That is the indispensable piece of the equation. So here's what we know in conclusion. We know that New York City has a long history of being a beacon to the world. We must be a beacon to the world again as we face these new challenges. And that means, again, that core component, New Yorkers rising to the challenge. It means drawing out all the talent that is here because it is breathtaking. The energy in this place is unsurpassed. And you can feel it if you are someone visiting for a weekend, and you can feel it if you've lived here your whole life. The energy is like nowhere else in the world. There will be a rebirth. There will be a renaissance for New York City. And anyone who wants to be a part of that, I invite you to the table in this great effort to create solutions that never existed before for the challenges of today and tomorrow. Everyone who wants to be a part of that mission is welcome. And the one thing we know is it must be for everyone. We must see the transformational moment and build every day solutions that reach every person. And finally, it bears saying, New York City has had many great eras, and New York City has had many setbacks. I often quote the truism, it doesn't matter how many times you've been knocked down, it matters how many times you get back up. So I predict to you today that not only will New York City get back up, but New York City will go farther than it ever has. And the best is yet to come. Thank you. Few words in Spanish. Los neoyorquinos han hecho un gran trabajo en la lucha contra el coronavirus. Hoy anunciamos un plan para recuperarnos que se concentra en buenos trabajos, atención médica y justicia social. Tenemos una gran oportunidad para crear una mejor ciudad que trabaje para toda la gente. With that, we will turn to our colleagues in the media. Dave.
You want us to go to the microphone here?
Yeah, I think it'd be good to get the microphone.
Mary, it's good to see you. I wanted to ask you, first of all, just the nitty-gritty here. I got tested last week at CityMD. It took 4 days to get the test back, which I was kind of surprised that it took at only 4 days. But if you could just compare what the citywide average is, do we know, for most of the testing that's going on in other locations, and then compare that to, I think we said,
sure,
24 hours here. And I did have a second question.
I'll call up whichever of our good doctors wants to speak to the latest numbers. I think, Dave, we've seen a real skew between the private labs and the public labs. Now, this facility here will focus on our health and hospitals testing. And that's been essential for so many communities. And obviously the focal point of a lot of what we've done is we've been opening schools. The public testing has been pretty good in terms of fast turnaround. The private has really varied according to the national dynamics too much. And this is why I say we still don't have a coherent national system here. So I do want to keep encouraging all New Yorkers to take advantage of the opportunity at our public testing sites. But which of you, Dr. Katz, you want to speak to public and private, how we're doing?
Thank you. Well, the same week that I read an article that in France it took a week to get the result of your PCR test, all of the health and hospital facilities were delivering it within 48 hours. And with this lab, we're going to soon be at 24 hours, be able to turn around the test. So right now, in general, if you go to Bellevue, 1 block away, 48 hours would be the average time you'd have to wait. As the mayor said, depending upon where the test is being sent from other centers, we've heard 4 days, 5 days, 6 days.
And I can just round that out with the citywide numbers. So the majority of tests are coming back within 48 hours now. That's citywide across all different testing sites. 3/4 of all tests are coming back within 4 days. And we are seeing for urgent care centers in particular, like the CityMD, sir, that you went to, it's generally within 4 days for urgent care centers.
And my second question along the same issue, how is this mayor going to help you, do you think, or hope at least, with schools, more schools opening, or the schools opening next week?
Dave, look, anything that improves testing improves the willingness of people to get tested. I mean, just think about it. I think there's been legitimate feeling that folks got discouraged if it took too long for the result to come back, because it's less pertinent if it comes back after a longer period of time. And by the way, for all of you who have been tested, I've been a strong proponent of the easier, less invasive test, the self-swab we call it, where they pleasantly run the test around inside your nostril rather than the more elevated tests, shall we say. So I think literally it's been a tactic to sort of make testing simpler, less invasive, to make sure everyone knows it's free, readily available, but it has to come back fast for people to want to do it. So this is an encouragement to people to see those public testing sites coming back in a day, 2 days. That is going to encourage, and that's going to help us continue to open schools. The more people get tested, everything interrelates.
A friend who works in the nursing home industry said there seems to be a discrepancy between the city and state over whether the DOB inspectors have to submit to screenings. The state is requiring that all inspectors in nursing homes submit to screenings, but the DOB inspectors are refusing to, and the chief inspectors told him inspectors are to self-monitor health, exempt from on-site health screening, and are regulators, not visitors. So what's happening now is they can't get any inspections done because the inspectors are refusing to submit the tests. Can something be worked out between the state and the city in that regard?
I have not heard that previously. I'm concerned, obviously. I want to see if Dr. Choksi wants to offer anything. That's not a problem that's been raised to me, at least, but we'll look into it right away. We obviously want to keep everyone safe. Doctor, you want to add?
No, I'm not aware of this specific issue either. What I will say is, in general, nursing homes, because we know the risk of transmission is so much higher, we have an abundance of caution approach with respect to screening in nursing homes. But we can certainly look into the specific issue with inspectors and find that out.
Well, it's for the commissioner also. Has there been a single documented case in New York or across the country of someone who had antibodies, a significant number of antibodies, and then subsequently tested positive again for the coronavirus?
Yes, the short answer is yes. There are documented cases of reinfection. Essentially, someone who was infected some period of time ago, it could be several months ago, who recovered and therefore has antibodies, and then was subsequently reinfected with the coronavirus. I want to be very clear here. We're talking about an extraordinarily small number of cases right now, and it's an area where the science is still emerging for us to understand just how common that phenomenon of reinfection might be.
Any ballpark, how many?
We're talking about in the single digits that have been reported thus far.
Yeah, thank you, Barrett. First of all, thanks for doing this in person. It's a nice change of pace from the virtual format. But going back to your vision for the recovery, when you talked about investing in public health infrastructure and creating jobs, could you speak to the funding that would be involved for this? Do you see taxpayer dollars involved? And if so, any ballpark figure, like any more specifics?
Let me speak to that, and I want to also say I had meant to provide the daily indicators, so just a quick programming note, and then I'll answer your question. Just want to give everyone the indicators for today. On hospital admissions, we are at 56 individuals for a day, 56 patients, with a confirmed COVID positive rate of 9.72. New reported cases on a 7-day average, 320. Overall testing in the city, 1.20%. To your question, so a couple of things are going to happen here. One, as the city makes decisions about our investments, our capital funding, we're going to prioritize these investments in healthcare as the core of our economic development strategy. So we will spark, as we have sparked before with life sciences, for example, or a great example from the previous administration with Cornell Technion Roosevelt Island, we're going to make investments that spark activity in health innovation, public health. But there's also a tremendous amount of resources that will be available going forward, because I am convinced the federal government will start to invest deeply in addressing the danger of future pandemics. The academic community, the opportunities for research grants, obviously the private sector, which is looking to deepen its efforts in this area because everyone understands this will be the nexus of our future. So we'll make smart and targeted investments, but I believe there's going to be a lot of other resources that will go where the action is, and we have to make this that place. And James, you want to? Where's James? You want to add?
Since I think you asked also about testing specifically, funding for testing. So I will just say, just to give you an example, we were paying over $100 per test for national reference laboratories. This lab, we're paying $28 per test. So we've cut the cost by about 75% or more using this lab. And our new rapid testing competition that we launched today, we're looking for tests that cost between $5 and $10 and can be completed within 15 minutes. So we're talking about rapidly scaling up testing using our existing funding for testing, which is a mix of federal and city funding, but cutting the cost dramatically, and in this case by more than 90% for rapid testing, and here today already by more than 75%.
Yeah, I also noticed that you didn't mention crime when you were talking about your vision for the health and economic recovery. Why not incorporate, when you're talking about public health, public safety, where do you see that fitting in for your vision for the remainder of your term?
As I said, we're going to be putting out specific plans, and we're going to be talking about a lot of things in those plans. We obviously need to regain what we had for years, which is tremendous success fighting back crime at the community level. And we're only going to do that by working with communities. It kind of parallels what I'm saying about healthcare itself. The solution is to work with communities, and that's what neighborhood policing is all about. But again, today is to talk about a bigger structure, a bigger foundation. Over the next weeks, we're going to be putting forward a number of very specific plans.
For Dr. Katz, since folks in the communities you enumerated yesterday gathered for the Jewish holiday over the weekend, do you expect the positivity rate to rise, as we test going forward?
So we're particularly concerned for those of you who don't know the Jewish traditions. We're in a very special time right now. Between Rosh Hashanah and Yom Kippur, there are not a lot of celebrations, right? This is for us Jews a time of reflection. What we're particularly concerned about is going into the Sukkot holiday, which is a very different, a festive holiday where people typically meet together to celebrate. And so that's why we're going to redouble our efforts in all of the Brooklyn neighborhoods. We're going to be with our cars and with their megaphones attached with messages in Yiddish and in English, reminding people that we can continue to have our celebrations and our meetings, but we have to, as you are doing, be wearing a mask, and as we're all doing, be socially distant. And if we do those two things, we will be able to. Dr. Chatsky and I, with the mayor, are watching very closely the numbers. We look at them every day, sometimes more than once a day. We look at the testing numbers, we look at the case numbers, and we're prepared if we need to take more stringent actions in order to prevent infections and prevent the nightmare that we all experienced in March and April. We'll do so.
And if you lived in one of those neighborhoods and you were inclined to worship, would you attend services indoors?
I would attend services indoors, but I would be wearing a mask, and I would not be sitting next to someone who wasn't part of my family. And that's what we're asking. We're not asking that people not celebrate the holiday. We're asking that people wear masks, and we're asking that people be socially distant.
Thank you.
Yeah, thank you, Mr. Mayor. I was just wondering, this rapid testing, can you say more about this rapid testing competition? And are you considering rapid testing models that are already existing, like the one that Yale developed? And can you give us, I know you said more detailed plans will be coming in the further weeks, but can you say anything more about what this rebirth entails, what's going on at Governor's Island? Any specifics that you can provide us would be greatly appreciated.
Okay, that's a little bit sprawling, but let me do my best here, and I'll have James speak to the competition and Claire give you a little more flavor of what's happening on Governor's Island. Remember, we talked about Governor's Island back in what feels like ancient history, back at the time of the State of the City at the beginning of the year. This is a crucial piece of the vision. And again, we've got to understand that we need to be the place. this city needs to be the place where that innovation happens. And that's both, I believe, a moral statement, but also a statement of how we achieve our rebirth. So just to summarize it before my colleagues, I think this is where you take New York City's inherent strengths and the call to action of the moment, and you combine them strategically. The whole world is going to need answers to the healthcare crisis. The whole world needs answers to the coronavirus crisis, but also how we prepare to stop any pandemic in the future. The whole world needs answers to the crisis of healthcare disparity. If we are the place where those answers are being created and tested and proven, a huge amount of investment comes our way. A huge amount of jobs are created. Equally with fighting global warming. If we increasingly are the place creating the solutions, an immense amount of energy, investment, job creation happens here. James, you want to start on the competition?
Morning. We're putting out a paper on this shortly. The competition is launching today. We have a website that will be up today. We're using the model we used for the pandemic response lab, except we're doing it publicly and open to everyone because the approach we used here was we put out a set of criteria and we said the city was prepared to make a financial commitment to the lab results, and that was all we needed to get a substantial amount of interest. We had close to 10 proposals, but this was we did it more directly targeted people who we knew were advancing this technology and could do it in New York City. This is at least national, and we'd be open to global responses as well. The amount of innovation happening in rapid testing, it's happening very rapidly. So we're open to any response. The goal is tests that cost less than $20. Results that results that can be gotten in less than 20 minutes, and tests that cost $5 to $10. And so it's the city's commitment to use these at scale. Our belief is that the most important thing to economic reopening is testing. Today, we're doing that by using PCR testing. It's still going to take 24 hours realistically to do that at the city scale that's necessary. The thing to bridge us to a vaccine is rapid testing at significant scale. Corporate partners are interested in this. The city itself is interested in this. Every employer wants to have rapid testing. It's the difference between being able to knowing if you can go into a restaurant safely or not. And you doing it at that speed is essential to economic reopening. And that's why this is an open call to innovation anywhere. This includes tests there are a few that are already FDA approved, but there are a significant number more that are coming within the next few weeks. And we want to look at all of those options. And we already have a criteria for evaluating them.
For a follow-up, I wanted...
Hold on, the second part. Claire Newman's the president and CEO of the Trust for Governor's Island. Want her to give you an update on where the vision stands.
Thank you. As we've been talking to collectively about the plan for Governor's Island, what we've heard loud and clear, and it relates so much to what's being talked about today, is the intersection between the issue of the threat of climate change and public health and economic vitality. And so what we've heard is there's a clear need within the sector to bring together under one roof issues of science, issues of real on-the-ground solution making, alongside policy and communications, so that we can leverage the talent in New York City and everything that the city has already done in the fight against climate change and begin to continue to build the political will to really see these changes implemented. So attracting a cross-sector
local economic development organizations. It's not just the big famous names, it's everyone.
Just as a quick follow-up to that, but your 5-borough solution in terms of specifics, what is it that we're sort of waiting to hear? Is it a number of jobs? Is it a construction timeline?
All of the above. We want to lay out how we get there, like every other blueprint in the world. We want to lay out how we get there. To me, you start with a big vision and strategy in all great endeavors. And then you put together a blueprint, and it gets more and more specific as you go along. So what we'll give you in the coming weeks is the next steps on how we get there. And then we're going to learn by doing, as with everything else. Okay, Katie, and then I've got 2 more, and we are done. Go ahead.
Oh, okay. I wanted to ask, following up a bit about what Andrew asked about the economic recovery. I know you said it's not about Midtown, but looking at the people who work in the tourism industry, which has been hit the hardest, if it's at LaGuardia and JFK, or if you're a stagehand or an usher, it's not the elites, as you say. So does the city have a plan for helping people within this industry, whether they work on Broadway or off Broadway, or at an airport or at a hotel? Because again, those are not, as you say, elites living in Midtown. They tend to live in the outer boroughs, and they are people of color.
100%. But I think the point today is everything depends on healthcare. That, remember, this is both how we overcome the immediate crisis, which then allows us to restore our economy and our lives, but it's also the future of our economy will be more and more about healthcare. So, yeah, of course we want to bring every sector back. And again, if Vicky or James wants to add, you're more than welcome, but I would just frame it this way. These are not mutually exclusive concepts, but direction and strategy have to actually land somewhere. And I don't, again, I never blame you guys for wanting to talk about whatever individual concern you have or constituency you're concerned about or piece of the equation. That's normal, that's healthy. But what I'm trying to get clear is a strategy means a direction. You have to choose a direction. And that direction can't be everything. We believe this direction is what gives us a stronger foundation for the future. It's also how we come back now. Vic, you want to add?
Thanks, Katie. So, of course, we're concerned about every single sector, and of course, we're very concerned about the way that this economic crisis and COVID have affected Broadway, have affected our theaters, et cetera. But key to that is exactly the kind of testing, quick testing, so that we can use that to make it safe for people to come back to those places. That's key. And what we're saying here is these are foundational aspects of every single sector. We've got to have the basics of public health in place so that we can bring those sectors back quickly, safely, and fairly, right? But that involves a whole range of things: testing, making sure that we've got, a plan to disperse the vaccine as soon as it's available, all of those things. But it also means things like making sure that our streets are clean and all of that. But the key focus is everything's got to be based on bringing people back safely, and that requires investing in public health.
Okay. And my second question speaks to the healthcare equity issue that you talked about. I know Dr. Katz is here. There are parts of the city, as been noted multiple times throughout the pandemic, that are lacking in hospital space, and it's a serious issue. There was a plan to expand Elmhurst Hospital. It's now delayed because of COVID. So going into what could be a second wave or something, are there concrete plans to actually create more space in parts of the city that do not have enough hospital beds, as we saw during COVID?
The first thing I want to say is our job is to stop a second wave. Stating the obvious, that there does not have to be a second wave like we're seeing in much of Europe, for example, if we continue to be tight and disciplined and fast to respond to problems. As I bring up Dr. Katz, I'll say, I think that for the right now crisis, it is the ability to expand hospital bed capacity in hospitals as they are. We're obviously not building new hospitals from scratch, but we can expand rapidly if needed. But our goal is to not end up in that situation.
Thank you, Mr. Mayor. 2 thoughts. First, overwhelmingly, the problem was staffing, right? Having enough intensivists, having enough intensive care nurses, having enough respiratory therapists. And the second level problem was equipment. Physical space was never, for us, the limiting factor. But I think also, to your point, we're opening a COVID center, thanks to the mayor, that's just blocks away from Elmhurst, and that COVID center is going to have capabilities for advanced radiology, so that people who have respiratory issues can be evaluated, testing. So we do see, to your point, to the truth of your point, there do need to be more centers, not necessarily inpatient beds, but definitely more places. Also, the mayor challenged us to open NYC Care back up to the entire borough so that everybody is assured that they can have that connection to a primary care doctor, free care, pharmacy, late at night and the weekend. So. No, I think I said in April that it wasn't going to be space. It was going to be people and equipment. But I understand it's complicated.
Hi, Mayor.
Yes, you definitely did say it was about people. People was the biggest part of the problem in April. Go ahead.
So with the lack of tourism, there's several hotels that are closing and laid off thousands of workers. What are you doing to help that industry? And you have a lot on your plate. So are you designating anyone to help specifically with the revitalization to help these hotels?
Well, obviously, our Deputy Mayor for Housing and Economic Development, Vicky Bean, is working with all sectors. In fact, has had, I don't think hundreds is an exaggeration from the beginning, hundreds of meetings and Zooms and one thing or another with the sector councils we put together and with leaders of different industries to discuss what they're going to need and how we can help. The situation in the hotel industry is very, very painful. But again, I think we see a couple of big strands here. The way back for New York City is through becoming healthier all the time and continuing to build up the things that will bring people here. So the best thing we can do for the hotel industry is get ourselves on that strong, healthy footing and continue to create the things that people need to come here to be a part of. In terms of their overall situation, it's very, very troubling. But we can't do, as is true with other industries, we can't do what we would love to do, which would be direct support financially. We can't do that. That's beyond our reach. What we can do is try and bring back the bigger picture. Do you want to add, Vicki?
And it's certainly a multi-pronged approach, right? We're trying to get people back out into their neighborhoods, get them into restaurants. Obviously, that's been incredibly successful, where we're telling people, take a staycation, celebrate your anniversary here in our hotels, that kind of thing. We're working very closely with New York City and Company, which, as you know, is doing this All In NYC campaign to try to get people, again, out doing the things that we can do as local tourists, and looking forward to the time when we can start bringing people from other states and other countries to enjoy all that New York offers.
And then the second question is, this is great to do these press conferences in person. Will you be doing them daily moving forward?
We're going to have to see what goes on with the coronavirus and everything else. Just premature to answer that right now. Nolan, you are last for today. Come on up. Guys, I've said a limit, and when I say a limit, it's the limit. Go ahead. I said we had two more. Guys, come on.
Mr. Mayor, on behalf of my colleagues.
All right, if you wanna call it here, we can call it here. Guys, we've had really clear, consistent rules. Either live by them, or if you don't want to participate, you don't have to.
Well, Mr. Mayor, we all got on the train. We all took risks when it comes to public health to get here. I mean, it's just, these are longstanding membs of the press corps, as am I.
Guys, look.
I mean,
This is your, do you want to ask a question or not?
Sure, I really, sure. So on April 26th, you announced a Fair Recovery Task Force. A couple of weeks later, you announced a series of committees that were going to develop individual policy proposals. It's now the end of September. We still don't have any details about a recovery plan. What have you been doing for the last 4 months?
Again, we have been bringing back our economy in phases 1, 2, 3, 4 on time, and we've stuck with it. We have been bringing back our health situation, which is foundational to everything else, and why we are now one of the safest places in the country. We have been bringing back our schools. That's what we've been doing. Go ahead. Can't hear you.
Well, the mic
there you
went
go.
off. To follow up on that point, there have been detailed plans that were developed by the Deputy Mayor, Vicky Bean, with the help of Alicia Glenn and the former head of City Planning, Carl Weisbrod. There was the Transportation Surface Commission, which came back with a whole host of its own recommendations. They've loudly complained. All of those were sidelined. And again, it's the end of September, and you're saying you have a vision for the revival of the city, but again, there are no details. There's no handout today that I can give back to my desk saying, Mayor de Blasio has a punch list of 20 things he would like to do.
No, and respectfully, as we just said really clearly, here's the bigger vision. You're going to see paper today on some of the specific pieces that are happening immediately. You're going to see a bigger plan. This is bringing back a city of over 8 million people. It is something that has to be done the right way. So again, we have continued to bring back our city. Now we're talking about a bigger vision. We're going to lay out specific plans. We're going to go from there. It's everything has to keep building. And I think it's a pretty clear strategy. Because again, I think what I would urge you to just focus on for a moment is, do you hear a strategic vision of where we need to go? I think it's a very clear strategic vision of where we need to go. And then over the coming weeks, pieces will get put in place, the planks to make it come alive. Thank you, everybody.
On the Borough Park outbreak. Mr. Mayor, separately on the Borough Park outbreak, Mr. Mayor, we got on a train, we risked our public health.